Today, I just want to touch base a little bit on why IV therapy has been a game changer at Blue Mountain Wellness. The number one reason is that most of our patients that come in here, they have some sort of trouble with their gut. There's dysfunction there. And whether that's from chemicals, toxins, processed foods that are messing up the microbiome of the gut, a lot of patients are not metabolizing nutrients the way that they should. And aside from that, the foods that we eat, they just don't have the minerals and the nutrients that your body really needs to get. So doing an IV, we're able to actually push nutrients, bypassing the gut and get them right into your bloodstream. And this is gonna help reduce inflammation, it's gonna help promote cellular healing, and it's gonna help to really optimize your recovery. We use that with a lot of our patients. And one of the most refreshing things is, coming as a chiropractic background and a lot of the advanced therapies that we do, typically a lot of the newer things are not covered by insurance, but IV therapy is actually something that's been covered, is getting paid for a lot of times in full by patients' commercial insurances. And it's been really aiding to help optimize recovery and much faster. So if you're having fatigue, if you're just brain fog, if you're having a lot of illnesses, reoccurring long haul COVID symptoms, the IVs can really help with that. I've also found that it's a game changer for my diabetic population, those with neuropathy, those with chronic joint inflammation and pain, because once we get those nutrients in, your body's able to just sigh a breath of fresh air of relief. And as the body starts to heal and becomes in a state of well, that's when healing happens, and that's when our patients feel better, they sleep better, and they just function better. So if you're at all curious to learn more about that, I'm happy to sit down with you, my nurse practitioner, come in, we can do some blood labs. We can look at the blood labs from a functional standpoint, not just, well, everything's in optimal range, because honestly, we know most of the patients that come in, they're not feeling well, their blood levels are, quote, normal, and they really need to be looked at by a different provider with a different lens. And we look at things with a different lens because we have a different set of tools in our toolbox. It's not just medication to prescribed based on current specific symptoms. It's actually getting to the root of why these symptoms are persisting and why this patient isn't feeling better, and to help them out. So if you or a loved one struggling with any of the things I just talked about, reach out to us. We're here to help. We've been doing it for over a decade, and this might be the solution that you've been looking for.